The coronavirus, now declared a global health emergency by the World Health Organization.
Happening right now. We promised you at the top of the show we'd let you know when this was happening. That plane carrying people from China has made its way to San Antonio.
First at 5, one case of the Wuhan coronavirus has been confirmed here in San Antonio.
Happening now, quarantine passengers from that Diamond Princess cruise ship in Japan landed in San Antonio just before 4 this morning.
The World Health Organization officially declaring the global coronavirus crisis a pandemic.
The first travel-related case underscores the importance of additional measures to protect the public.
I don't think I have seen anything like this ever. And I would say that if you want to see August 1st, then maybe you should stay indoors and isolate on July 4th.
Clinical Trials of Texas, located in the medical center area, is looking for 500 to 600 people interested in participating in a COVID-19 vaccine study.
There are 2 vaccines racing closer toward distribution.
It has finally happened. More help is coming in the fight against COVID-19. The U.S. now given the green light to use the Pfizer vaccine.
These are photos of the first shipment of Pfizer's COVID-19 vaccines.
We've been waiting for it for a long time.
Good evening and welcome to a KSAT 12 special, the vaccines ending the COVID-19 pandemic. It has been a long journey, but we can finally see a light at the end of the tunnel.
Mass distribution of the COVID-19 vaccine is underway after it was developed in record time. But scientific advancement has ushered misinformation, and now more than ever, you need accurate information.
Tonight, we'll talk about the vaccines, the science behind them, the facts and the myths. The city's plan for mass vaccine distribution as everyone eagerly waits their turn, the challenges and the road ahead.
But first, we start with the stories of those who have lost their lives to COVID-19. More than 400,000 people have died in the U.S., more than 1,700 in Bexar County alone. These deaths are more than just numbers.
He was a God-fearing, honest man. He loved his family, and he loved the Lord.
As soon as you became friends with her, she would love you with all her heart.
A great man gone too soon that would do anything for his kids, anything for his grandkids, and anything for his community in general.
He was just a beautiful, kind soul.
She was a beautiful person that has put a light in a lot of people's lives.
She was who you wanted her to be when you needed her to be that person. She could offer you guidance and comfort, love. She was everything I could have asked for in a person and a mother.
The COVID-19 vaccines bring hope for ending those painful losses and the pandemic. The scientists who developed the vaccine so quickly are being hailed as heroes. In just 11 months, doctors have a vaccine to inject into our arm.
The previous record for the creation of a vaccine was 4 years. The unprecedented speed of the COVID-19 vaccine is making some people uneasy, but it shouldn't. One explanation for the vaccine's speedy development is scientists around the world were working around the clock even before the coronavirus pandemic was on anyone's mind. In January 2020, Chinese scientists identified the genetic sequence of COVID-19 and published the information online. Once research teams had the genetic code in hand, the race to find a vaccine kicked off.
When the genome was published on January 10th, I was home and I got an alert on my phone, and my immediate reaction was go.
The genetic code was quickly discovered because of the years of research on other coronaviruses like SARS and MERS. So when researchers took that code and paired it with messenger RNA or mRNA technology, they developed a vaccine within weeks to test in animals.
This is what enabled us to have a vaccine go from discovery to your arm in 11 months. An incredible story of science. Science is the hero here with regard to our chance to get back to anything that resembles normal.
mRNA is the science used to create the Pfizer and Moderna vaccines. mRNA vaccines have never been approved by the Food and Drug Administration until now. But the technology isn't new.
I think people are hung up on that and really scared about it, but the technology has been around since at least 1990. People have been working on this in animal models and so on.
Most of the vaccines you've heard about put a weakened or inactivated germ in your body to trigger an immune response, but not mRNA vaccines. So here's how they work. mRNA is a genetic material that enters human cells and instructs the cells how to make a protein.
Our immune system reads the recipe and it creates a protein, and then it displays that spike protein on its surface, and then it throws away the mRNA. It's like doing a recipe if you're to bake a cake and then to burn the recipe afterwards. So it's no longer available. It breaks down, but it puts the spike protein or the cake from the recipe on the surface of the cell, and then the immune system starts to recognize it, and it creates antibodies against it.
So if you were to get the virus, those antibodies would fight it off. Something else that helped researchers develop a vaccine so quickly: unprecedented financial support.
A lot of money from different governments around the world were used to help speed the process in research and development.
The U.S. government funded the manufacturing of several candidate vaccines, including Johnson & Johnson, Moderna, AstraZeneca, Pfizer, and more. It was dubbed Operation Warp Speed. In March, clinical trials of the Moderna and Pfizer vaccines started around the nation.
There are 3 phases. Phase 1 and 2 are normally smaller groups of volunteers. 22-year-old Kylie Stamey joined phase 2 of the Moderna trial in May.
I don't know yet if it's the placebo or the vaccine.
Stamey says the process has been thorough, and she's confident corners weren't cut.
So to me, it didn't feel rushed because, again, I'm over 6 months into this and I'm still following up. I'm still getting blood draws.
Researchers are still monitoring her closely. By July, phase 3 clinical trials got underway, which included tens of thousands of volunteers. Dr. Douglas Denham oversaw phase 3 of the Moderna and Pfizer clinical trials in San Antonio.
In terms of safety, there's no concern whatsoever. I can honestly say I would take the vaccine the day it's available in my family too.
Helen and Cheryl Tsett joined phase 3 of the Pfizer vaccine trial in the summer.
And so we were like, well, heck yeah, we want the vaccine eventually, so why not do something to help research as well as benefiting us later.
They recently received the COVID-19 vaccine after finding out they didn't get it during that trial.
The difference between us and the shot was that my arm hurt like crazy for 24 hours. Just like, it felt like somebody punched me. But other than that, nothing. And Cheryl didn't have any problem.
Stamey reported a similar side effect at the injection site.
I kind of had a soreness for 2 or 3 days. That can happen with the flu vaccine or any shot.
You might also feel other side effects after receiving the shot.
You may feel achy. You may have a low-grade fever. These symptoms are expected to last no more than 24 or 48 hours. And then rarely individual people could have a more serious reaction down the line. That's usually going to happen within weeks, not months, not years, but within weeks. And we really haven't been seeing those.
And those side effects are a good sign. It means the vaccine is working. Both Moderna and Pfizer vaccines have shown remarkable effectiveness. They are more than 90% effective at preventing COVID-19. Both require 2 doses.
You're going to have to come back 21 or 28 days later, and you cannot mix and match. You cannot get Pfizer vaccine number 1 and say, I think I'll just go try the Moderna for number 2. It doesn't work that way. They're not designed that way.
While some Americans remain hesitant about getting the vaccine, doctors and scientists in San Antonio and around the world encourage everyone to get vaccinated.
We're trying to reduce the number of deaths we're seeing, and that the vaccine can protect against those serious outcomes from infection. I believe the studies for the lead vaccines right now, Moderna and Pfizer, are safe vaccines.
While only 2 vaccines have been approved for use here in the U.S., there is no shortage of other vaccines in the works. Some could see FDA approval in the coming months.
2 of those, the Novavax and Johnson & Johnson vaccines, are currently in phase 3 trials. And Novavax is doing part of its research right here in San Antonio.
These are different technologies to get to the same goal.
That goal, to prepare our body to fight off the virus should we ever come in contact with it. One way to do that, as we've learned, is through the use of mRNA. But it's not the only way.
The Johnson & Johnson vaccine is in a different platform. It's called a viral-based platform. What does that mean?
That means Johnson & Johnson researchers are using a separate virus, similar to the common cold, which has been disabled so it can no longer cause infection. It can then be modified to resemble the spike proteins that make up the coronavirus and injected into the body.
And so now the virus comes in your body. It can multiply but not cause any infection to allow for the production of that protein. So the end result is quite the same as the Moderna and the Pfizer, but if you will, the way it's delivered has changed.
As for Novavax, its vaccine injects parts of these coronavirus proteins directly into your arm.
So it's only a very small portion. It's not the entire virus, so it can't cause infection, but it's an important part that's specific to this virus to create an immune response.
This vaccine works similarly to already existing vaccines used to treat pneumonia, hepatitis B, and human papillomavirus, or HPV. Both the Johnson & Johnson and Novavax vaccines have their pros and cons, and we, of course, will rely on clinical trial results to tell us whether they're safe and effective. But one area the Johnson & Johnson vaccine might have an edge is its required dosage.
They're looking at both a 2-dose vaccine series, but they're also looking at a 1-dose series. They're actually comparing both of those to see how much protection you get from just 1 dose.
And going by trial results from earlier phases, the Johnson & Johnson vaccine showed an immune response in a majority of candidates, which lasted for at least 71 days with only few side effects, which all cleared up within 24 hours. So why else is a single dose important?
Obviously, that would improve ease of administering that to people in the community. You can give it to more people and you don't have to worry about scheduling the second dose.
Even further, a single dose could be useful when it comes to improving vaccine compliance, especially when minor side effects from a first dose may create hesitancy to get the second dose.
If 1 shot and you're done is out there, that's an advantage.
An advantage both vaccines have over Pfizer and Moderna is how they're stored. While the 2 existing vaccines require freezing temperatures for long-term storage, Johnson & Johnson and Novavax allow long periods of refrigeration, which could be crucial for hospitals and pharmacies in rural areas.
Well, that will help get it to all parts of the world and to all individuals who need the vaccine.
And more good news, several other vaccines are still coming down the pipeline, which means more opportunities to vaccinate more people.
The quick development of the vaccines has also encouraged people to spread fake information about them.
We take a look at 5 popular myths as scientists and doctors battle against misinformation.
Debating between the sandwich and her signature chicken? That's why we created the Popeyes $12 Pirin and Sharon. With 2 sandwiches, 2 pieces of our signature chicken or tenders, and 2 biscuits for just $12. We made it easy, so you don't have to choose anymore.
Love that chicken from Popeyes.
At Living Spaces, we offer reclining designs for everyone and every occasion. Whether you go light and sophisticated in a modern space or go dark and cozy in a casual space, the possibilities for stretching out and enjoying yourself are endless. We make it easy to pick the perfect design for your space. Come find a recliner you love at a price you love in the Life in Motion collection. Only at Living Spaces.
Living Spaces.
Your family is important to us, and that's why CentroMed has a team of pediatricians and pediatric nurse practitioners trained to take care of children's health care needs. Call 210-922-7000 or log on to centromedsa.com.
My family and I came to the United States in the 80s. I was this little kid who didn't know anything. In order to change myself, I had to get educated, and I had to differentiate myself from everyone else. Now I have an MBA in marketing. That degree has given me the ability to be able to grow as an individual and also as a professional. There is nothing that can set you back. Only you control that.
American Military University. Learn from the leader.
Your mother is a special lady, and on her special day, you promised her a special celebration. But if slow upload speeds won't let your video call through because you have cable, just remember, you're not a bad son. You just need better internet.
AT&T Fiber delivers a faster internet experience with 20 times faster upload speeds than cable. Bundle AT&T Fiber with AT&T TV starting at $84.99 a month for a year. Limited availability in select areas. Call 1-877-ONLY-ATT.
Aside from stopping the spread of the virus, one of the biggest challenges that comes with battling the COVID-19 pandemic is the uncertainty. A big role in achieving that goal is combating rampant misinformation.
We have all heard many of the conspiracy theories and beliefs which have played a role in diminishing trust in the vaccine. But as the old saying goes, don't believe everything you read online.
Dylan Collier with 5 common myths about the vaccine and why they've been debunked.
In an attempt to gauge public opinion and dispel some of the more popular rumors circulating about the vaccine, we utilize the very tool being used to spread those falsehoods, social media. Given the options, I think this is true and I think this is false, KSAT 12 Instagram followers voted on 5 of the more popular vaccine myths we've heard about. Out of 990 respondents, 18% of those polled believed a vaccine isn't necessary if they've already been infected and have recovered from COVID-19.
You cannot assume that you're protected from getting infected as a result of having had that infection. What the vaccine will do in those individuals is further bolster or ensure that that immune system is fully engaged and help prolong the period in which you're protected.
There are still too many unknowns about the virus to guarantee your immune system has had a robust enough response to an infection. So it's crucial to get vaccinated, even if you've recovered from an infection, at least until we learn more. 85% of the 921 who answered this question believe there is no truth to this myth.
I'm not aware of any desire for us microchipping these current vaccines that we're using.
But for those who are still worried the vaccine plays a role in any kind of Big Brother conspiracy,
this vaccine is really here to avert COVID-19, not for any other purpose.
This one is simply not true. You may remember learning about mRNA in your high school biology class. And while some details may be fuzzy, you might recall it is linked to our genetic coding, or DNA. So it's not surprising 16% of more than 1,300 people believe a vaccine using mRNA technology would affect our genes.
It is not capable of getting into our DNA. It's short-lived, makes the protein that we need it to make, and then it gets degraded.
Easily debunked. 24% of nearly 1,500 respondents believe the vaccines use fetal tissue in some way during their creation, but
absolutely no fetal material in these vaccines. Let's put that to rest.
This is a big one we've been hearing a lot, and of the 5, this question received the most responses. The results, 23% of 1,555 respondents are worried this may be accurate.
There's been tens of millions of cases of COVID-19 in the world, and we are not hearing that all the pregnant women who got COVID are suddenly miscarrying their pregnancies.
When it comes to the vaccine, there is simply no data suggesting it is harmful to pregnant women. In fact, it is highly recommended pregnant women get the vaccine if possible. As for infertility,
currently, we wouldn't expect the vaccine to act any differently than we see with the actual infection. So the preliminary data from the vaccine has shown no concerns for fertility for men or women. So the short answer is it does not cause infertility.
There's a big concern that the COVID-19 vaccines won't work against new strains of the virus. Variants have been found in the UK, South Africa, and Japan.
Though much is still unknown, they appear to be more contagious than earlier versions of the virus, but so far, not deadlier. Myra Arthur explains these COVID-19 mutations and what it means for the vaccines already in use.
The Centers for Disease Control and Prevention says multiple COVID-19 strains are already circulating globally, but the 2 you've most likely heard about are the UK and the South Africa strains.
It's not shocking or surprising or necessarily even dangerous if a virus mutates. Mutation doesn't mean something bad happened, it means something changed.
All viruses do this, and the coronaviruses do this quite well.
The variants seem to spread more easily and quickly, but right now there isn't evidence that they cause a more severe illness.
Don't confuse ease of getting infected with how bad the infection is, because those are 2 completely separate things.
Local epidemiologist Charisse Rohr-Allegrini says the variants seen in other countries are probably already in San Antonio. The problem is, nobody is really looking for them.
It's probably been here for a while.
The only way to confirm if the mutation has made it to San Antonio is by looking at the genomic sequence, which helps identify the strain. Metro Health made a public request for help late last year.
So this is a plea to the healthcare providers and the labs to be a little bit more consistent about sequencing every single case of COVID so we can detect any mutation that might occur at the earliest.
The big question, how will these new variants react to the vaccines already distributed or in the works? Curiel says for now, they should still be effective because the recent mutations don't appear to affect the spike protein. That's what SARS-CoV-2 uses to infect you.
The S protein is really critical. The virus really needs that to latch onto cells, get inside and infect. All the vaccines out there have a component that trains your immune system to recognize that S protein, that spike, and to neutralize it with antibodies.
Pfizer and Moderna say it wouldn't be hard to tweak the vaccine if the virus eventually mutates enough to warrant a change. In fact, Moderna recently announced that its vaccine seems to be less protective against the variant discovered in South Africa. So it's creating a new vaccine that could be used as a booster shot. But the longer the virus is out there, the more it will evolve.
We have to pay attention to that and try to avert too many viral variants getting out there before we vaccinate more and more of the population.
Scientists, researchers, and doctors are racing to study the variants to provide the best information in the fight against this deadly virus. But they say it's important to understand that science changes, and that means information changes too.
We have the best information available today, and we're going to use that. Tomorrow, we might get new information, like a mutation that really is evil or really bad, which hasn't happened. But if that happens, then we'll change our thinking, not because we're wrong or because we're fools or we're running around in circles. It's just because this is a new virus. It's happening right in front of our eyes.
A logistical nightmare. Production, distribution, and allocation have proven to be a challenge during the vaccine rollout.
Experts warned the mass vaccination campaign wouldn't be a smooth or quick one. We take a look at the challenges to get the vaccine to the people who need it most.
What happens if I get COVID-19 after my first shot?
If you're sick with COVID and you're in between shot number 1 and shot number 2, is you should do your isolation, take good care of yourself, make sure that you are over the infection, that you have no fever, that you've completed the requirement of 10 days of isolation since the time the symptoms began. This may, in fact, delay the timing of your second shot, but we don't think that will affect the efficacy of the vaccine. Believe me, by that time, you've had vaccine number 1, you've had a COVID infection, and now you're getting vaccine number 2 shortly after your COVID infection resolved. You are going to be good to go with as far as your immunity.
Good morning.
Good morning.
GMSA knows South Texas, and it takes a team to deliver what you expect every morning.
KSAT's newsroom never sleeps.
So when you wake up, expect the latest news.
Investigators have their work cut out for them.
And your Weather Authority forecast. We double that up to 62 degrees.
And I'll get you through your weekend.
Walk out your door with an expert traffic report to get you where you need to be on time. KSAT knows teamwork counts.
Weekdays and weekends.
Start your day with GMSA.
Company cars, trucks, SUVs, vans, and fleet vehicles are involved in thousands of accidents every year. If you were hurt in a company vehicle accident, we make it as simple as 1, 2, 3. 1. Contact Thomas J. Henry. 2. Our attorneys will come to you day or night. 3. We will handle everything while you focus on healing. Thomas J. Henry handles serious company vehicle accident cases and gets serious results for injured clients. Call today. Thomas J. Henry is available 24/7, nights and weekends.
We've been helping San Antonio save money for over 35 years. If you have a car accident, we're now offering the largest discounts ever.
We're also donating $2,000 a month to the San Antonio Food Bank. They help many people, and they need our help.
If you'd like to save money and help the San Antonio Food Bank, choose Miracle Body and Paint. We discount deductibles and have the most 5-star reviews in Texas.
We work miracles.
Sounds like another amazing weekend. Brought to you by the Toyota Tundra and Tacoma.
Qualified buyers can get 0% APR financing for 60 months or $2,500 total bonus on a new 2021 Tundra Special Edition. Toyota, let's go places.
Right now at Rooms to Go, the ultimate TV packages are back.
At Rooms to Go, you should know by the room and get a big TV.
Choose from a big selection of room packages and get a 70-inch LG Smart 4K UHD TV and finance for 60 months interest-free.
Expect more. KSAT 12.
The vaccine rollout has presented a lot of challenges. It's been slow and confusing.
The CDC created guidelines for who should get vaccinated first, but the federal government left that decision to states, which, as you can imagine, creates confusion.
In Texas, people under Phase 1A, which includes frontline healthcare workers and residents at long-term care facilities, can get the vaccine. People in Phase 1B can also get the vaccine. That includes people 65 and older and people 16 and older with at least one underlying health condition.
Another challenge is manufacturing. Companies must produce massive quantities in record time.
Look, at the end of the day, every batch needs to have quality control, and every batch needs to be certified that it's safe going in your arm. I mean, you know, it's got to be not just manufacturing, but rigorous manufacturing.
So when will the vaccine be available for the general public? The state estimates sometime in the spring, But that all depends on production and distribution and whether other vaccines become available.
So how is our city handling the slow-moving process? Garrett Berger tells us the speed of distribution depends on how many vaccines are available.
Well, I think as a nation, as a state, and even in our own community, we're not where we had hoped to be at this point, given the vaccine we thought we would have.
Logistical delays have plagued the COVID-19 vaccine rollout. There are 4 mass vaccination sites around San Antonio. Only the one at the Alamo Dome is directly managed by the city. They can set up others quickly, but officials say that's not the bottleneck.
The problem is that we don't have enough vaccine.
University Health has the same problem.
We can only open slots for the vaccine that we have.
There are more than 20 other providers in our area that can administer the vaccine, according to the state, which means if you want a vaccine, you'd have to call every single one to see if they have one available.
Disappointment over the lack of a central registry here in the county came up at a recent city council meeting. Interim Metro Health Director Colleen Bridger said the state originally had a decentralized distribution plan, like with flu shots. But then she says they switched to an emphasis on mass clinics.
This was not the city dropping the ball.
The vaccine rollout has also been plagued by technical issues. Appointments for the first week at the Alamo Dome's mass vaccination event were filled within minutes. Many people said they couldn't get through the phone line. Others couldn't get through the city website.
I logged in, the site wouldn't load. Then about 9:02, it loaded. Bam, immediately registration's full.
And some thought they had an appointment, only to show up and find they didn't.
So I waited all through the line to get in. And then they said that even though I've got an appointment, somehow they didn't have it on the computer.
Organizers said the glitch was most likely due to the high volume of people visiting the website. The city says it will expand vaccination sites when more vaccines become available.
Just like people saw us do with the testing sites, right? We started with one big testing site, then we grew to 3 big testing sites, then we started opening micro testing sites. That's the plan for vaccination rollout as well. Not everybody will be at the front of the line, but we will get to everybody in line. It just will take some time.
In rural communities, some providers still haven't received their allotment of vaccines, and the initial rollout was 8 weeks ago.
Advocates say that jeopardizes the lives of frontline healthcare workers in those areas, which is already a small group.
It has been very frustrating for the physicians and the nurses that are working double shifts in these hospitals. They don't understand when they read in the news that almost any citizen in certain urban communities can get a vaccine, and they have yet to even see any vaccine.
Macbeth says a handful of rural hospitals in Texas still don't have COVID-19 vaccines. He says many of them have applied through the state's website to request the vaccines, but their applications are pending.
But that's a very cumbersome process. It's not a user-friendly system.
In January, Governor Greg Abbott touted the state's distribution efforts.
Never before in the history of this state has Texas vaccinated so many people so quickly.
As the virus continues to surge across Texas, that could be a big problem, especially when the nearest hospital is 60 miles away.
They don't have very many employees. They may have 10 or 12 nurses, 2 physicians, a physician assistant. And if half of those people are out because they're either infected with COVID or they're quarantined because somebody else had COVID, all of a sudden you don't have anybody to work in the hospital.
That staff shortage wouldn't impact only COVID patients, but also people driving through town who may suffer a medical emergency or get hurt in a crash.
If you didn't have that hospital out there to provide that early intervention and stabilization, the likelihood of the patient making it to the trauma center in a major city is going to be pretty low. So that's a very important role that they provide.
Rural areas didn't receive Pfizer vaccines during the first week of distribution. One reason, the minimum order requirement. Pfizer requires 975 doses, while Moderna only required 100 dose orders at a time. Another hurdle, special refrigerators needed for the Pfizer vaccine. Macbeth says some hospitals have been able to rely on neighboring pharmacies or hospitals to give them a limited number of vaccines.
And that's kind of how things work in rural Texas. Neighbors take care of neighbors. But that doesn't solve the problem.
He understands the state is doing what it can, but he believes something needs to be done.
We just need to move through this. This is an emergency situation. And sometimes you have to maybe cut a few corners.
As we mentioned, vaccine hesitancy is real. The National Association of Broadcasters and the Reynolds Journalism Institute took a poll in December. They found 52% of Americans are worried that the vaccine itself will make people sick.
Among African Americans, that percentage even higher, 63%. Our Daphne Gray takes a look at why history is partly to blame for the lack of trust in the Black community.
The exposure is so high that we need to do whatever we can to reduce the chances of acquiring the infection and the chances of dying from the infection. And the vaccine provides the best possibility.
Some residents in the African American community are on board with taking the COVID-19 vaccine.
I actually just had a baby, so he's 2 months old, so yes, I do plan on doing it for his safety and mine.
But some...
It's kind of iffy. This is a citywide, countywide, nationwide issue. So what are people saying? African Americans are saying, I don't trust the government.
A distrust that didn't develop overnight, but dates all the way back to the early 20th century.
You know, if you look through history, you know we've been done wrong, we've been tested and everything else.
Everybody knows about what happened with the Tuskegee study and how Alabama men were used essentially as guinea pigs to see how syphilis would naturally evolve even after a cure for syphilis had been obtained.
The city of San Antonio says African Americans, who make up 7% of the city's population, make up 4.8% of COVID-19 cases and 5% of COVID-19 related deaths.
We look at pre-existing chronic medical conditions such as hypertension, diabetes, chronic kidney disease, these kinds of illnesses. We look at not being able to work at home because you're working in a service industry or you're working in an essential occupation.
District 2 Councilwoman Jada Andrew Sullivan says she too recognizes the hesitation in her community, but she also sees another concern.
Most of what I'm hearing in my community, especially from those who are 65 and over, are afraid that they will not get the vaccine. They have been trying to call, they have been online, but we're continuing to ask them to stay vigilant. Keep finding those phone numbers and calling. Continue to call until you are able to get an appointment.
Andrew Sullivan says as a city leader, she will be proactive in educating those cautious about the vaccine.
We have to make sure that we are being very intentional and very forward and very transparent with how this is going to affect each and every person.
Other vulnerable populations are still waiting to receive the vaccine, with some facing additional challenges beyond a tied-up phone line.
How homelessness, lack of transportation, and the digital divide are impacting those already eligible.
What happens if I don't get my second dose?
Nothing happens per se. But so far, we really would like people to continue to take that second dose if possible, because that really offers the highest level of efficacy, probably around 90 to 95% for both the vaccines that are currently available.
It's all about sleep and savings during the winter savings event at the Revive Sleep Center inside Living Spaces, where you'll find the best deals on all the top mattress brands. For a limited time, get a Revive 1.0 Queen Adjustable Base with the Revive Series X Luxury Plush Queen Mattress, all for just $790. Plus, with your qualifying purchase, we'll donate a mattress to a foster child in need through Arizona Helping Hands, only during the winter savings event at the Revive Sleep Center inside Living Spaces.
Living Spaces.
Celebrate the new year in a new Subaru from North Park. Get 2021 Crosstracks posted now for $179 per month. Plus, every new Subaru includes 2 years or 24,000 miles of complimentary maintenance. Get your new Subaru at either North Park Subaru location today.
There's a new space to play, stay, ride, and slide. Now open in your backyard. With 1.5 million square feet of space to spread out and have some much needed fun. Kalahari Resorts and Convention, now open in Round Rock, Texas.
Come home to our made-from-scratch chicken fried steak, Charlie's catfish sandwich, onion rings, tender sirloin smothered in our not-too-spicy queso. It's Charlie's Steak con Queso. Hungry yet? Good Time Charlie's, open till midnight.
Guys, yay! A new phone's here. I switched to Spectrum Mobile. I'm saving money and I get 5G nationwide. It's literally the smartest thing I've ever done.
You split an atom with the soda bottle and 2 straws.
Oh, yeah. That was kind of an accident.
You found the 10th planet.
I mean, it was just all over the calculus.
You found a cure for hiccups.
Yeah, but nationwide 5G and I'm saving 40%? Come on. Oh, almost forgot. I figured out time travel, so we're gonna get nuts later.
Switch to Spectrum Mobile, get 5G nationwide, and save up to 40%. It's a better way to mobile. Spectrum Mobile.
Everyday extraordinary isn't aware of itself. It doesn't boast. It doesn't brag. It just sets out to make a difference. At University Health, Everyday Extraordinary always does more than what's asked. Everyday Extraordinary just quietly gives, so that we can give even more.
It has seemed nearly impossible for many people to get their hands on the vaccine, but we're hearing chances seem almost non-existent for those living in homelessness.
Courtney Friedman spoke with the Haven for Hope CEO about his plans and concerns when it comes to vaccinating the city's homeless.
We talk about COVID every day.
Haven for Hope CEO Kenny Wilson proud to report the campus has not had any COVID-19 outbreaks due to rigorous rules and expansion into a 315-room hotel. But vaccine uncertainty is hitting hard.
We've watched, with great interest and fear, really.
Haven for Hope's 300 staff members are frontline workers in Category 1A, so they've already been offered the vaccine. Most took it. That did not extend, though, to their 1,100 or more clients, but many are eligible for Phase 1B, 65 and older or 16 and older with underlying conditions.
We have hundreds who are in that 1B category, many with multiple vulnerable conditions, diabetes, heart disease, liver disease, all at once.
They do qualify, but are those people actually getting the vaccines right now?
Not that I know of. I mean, it could be that some on their own have gotten an appointment.
Haven staff members are sitting at computers with vulnerable clients, but with such limited vaccine capacity, they haven't found much success getting appointments. Wilson's hope is that eventually there will be a way for congregate organizations like Haven for Hope to get separate shipments of vaccines so they can distribute them on their own.
We have a lot of experience with vaccine. Every year we do the flu vaccine on the campus for every person.
Outreach teams are here on these streets daily, especially in bad weather like this, making sure the people who are not Haven for Hope clients are still getting the things they need. They plan to use that same type of outreach when more vaccines become available.
A lot, if not most, of the appointments to receive the COVID-19 vaccine must be made online.
As you can imagine, that could alienate seniors who may not be tech savvy or others without internet access. The Senior Planet hotline 210-504-4862 offers tech support and advice and information about low-cost Wi-Fi and computers.
For people who lack transportation, VIA is offering free rides to and from an appointment at a city-county sponsored COVID-19 vaccination site.
We know that a lot of folks can't drive very far or take the bus. And so we have to make sure that our locations are accessible through bus routes and that we give people plenty of notice so that they can plan on getting there if they do have to take the bus.
If you're using Via Bus or Via Link, just show your appointment registration information or shot record. If you're registered as a Via Trans customer, you must schedule your trip by phone or online.
San Antonio is known as Military City, USA, and the military has its own vaccine distribution plan.
Jonathan Cotto with who is being prioritized as the military works to vaccinate millions of active duty and retired veterans.
The Department of Defense is spearheading its inoculation efforts and say all vaccines among service members are still on a voluntary basis. DoD representatives say they have been adhering to CDC guidelines, prioritizing those at a higher risk of contracting the COVID-19 virus. The DoD has been working to distribute the COVID-19 vaccine as timely and safely as possible. It was initially allocated more than 43,000 doses, which were distributed amongst 12 sites within the U.S. and 4 abroad. The initial sites include Wilford Hall Joint Base, San Antonio.
The 59th Medical Wing began administering the Pfizer COVID vaccine on Monday, December the 14th. With operations ongoing 5 days a week since.
Still complying with the CDC, the DoD has made modifications to its rollout as well.
Our patients over 75 have been moved up in the priority schema to phase 1B.
Although thousands have been vaccinated, the military is having the same problems as others. The supply doesn't meet the demand.
Currently, we are using all the vaccine very quickly to vaccinate as many people as possible.
For one Air Force doctor, the opportunity to receive the vaccine was one he met with obligation to duty. Keeping healthy allows him to do his job.
While I was the first one in line, while I was the first one to get it, it wasn't for me. It was for my patients. It was for the patients that I can now see, so I don't have to be concerned about spreading this disease.
New recruits arriving for basic training along with other active duty personnel will be allowed to receive the vaccine during phase 2.
So they're in the final tier along with the rest of the military and family members and retirees and family members that aren't in a high-risk category that's of a higher priority.
For those serving overseas, a trickle effect of doses will begin making its way to those military installations and those serving on those bases. The Department of Defense is currently using both Moderna and Pfizer vaccines and plan to implement the Johnson & Johnson vaccines once it is approved.
Many are calling the technology used in the 2 available vaccines the future of science.
How this medical breakthrough can be used to treat other infectious diseases and how it prepares us for the next pandemic.
When will kids be able to get the vaccine?
It doesn't look like we're really going to be able to vaccinate all of our school children really until next year.
1 in 5 adults will experience mental illness this year. It's a hardship millions of Americans live with but don't talk about. Join us for our virtual mental health awareness town hall Wednesday, January 27th at 2 p.m. We'll have a panel of experts to explain mental health and how you can make a difference. Help us fight the stigma. For more information, visit ksatcommunity.com.
KSAT Community, in partnership with RBFCU, Energy Transfer, and University Health.
Start the new year off right with a new Toyota from North Park Toyota. Get 1.9% financing for 72 months on a 2021 Corolla LE, or lease for only $129 a month. The hottest deals are on the south side at North Park Toyota of San Antonio.
Your mother is a special lady, and on her special day, you promised her a special celebration. But if slow upload speeds won't let your video call through because you have cable, just remember, you're not a bad son. You just need better internet.
AT&T Fiber delivers a faster internet experience with 20 times faster upload speeds than cable. Bundle AT&T Fiber with AT&T TV starting at $84.99 a month for a year. Limited availability in select areas. Call 1-877-ONLY-ATT.
We've been helping San Antonio save money for over 35 years. If you have a car accident, we're now offering the largest discounts ever.
We're also donating $2,000 a month to the San Antonio Food Bank. They help many people, and they need our help.
If you'd like to save money and help the San Antonio Food Bank, choose Miracle Body and Paint. We discount deductibles and have the most 5-star reviews in Texas.
We work miracles.
Vaccines normally take years to develop, but that process has been sped up thanks to new technology.
So what does it mean for the future of medicine? Tiffany Huertas with how the technology behind some of the COVID-19 vaccines are ushering in a new era of medical science.
This is a breakthrough for the future, whether it be infectious diseases or cancer or other diseases.
mRNA, a medical breakthrough. The Pfizer and Moderna vaccines are the first ever to use mRNA and receive federal approval. Most traditional vaccines put a weakened or inactivated germ into our bodies to trigger an immune response, like the flu shot. But mRNA vaccines teach our cells how to make a protein that triggers an immune response inside our bodies. Scientists can customize it once they know the genetic code.
Where you could cut and paste in what you need and have your body's immune response be against a variety of viruses.
The CDC says future mRNA vaccine technology may allow for one vaccine to provide protection for multiple diseases. And that could mean decreasing the number of shots you need for protection against common vaccine preventable disease. In fact, Moderna recently announced it will be looking into mRNA vaccine candidates against seasonal flu, HIV, and the Nipah virus. Another advantage of mRNA, it can be made faster.
Traditional vaccine platforms take time to produce. They take months. Many of them are grown in cell culture, which means they have to grow, which means that there's an incubation period before it develops enough that it can be used. Versus this mRNA technology where they can scale it up in the lab and do it more rapidly so they can have a faster production turnaround time.
And that faster turnaround is crucial for when the next pandemic strikes.
There are other viruses, other bacteria that could pose challenges for us moving forward. And so it's important that we're learning from this and responding to it with proactive ways like vaccines.
The road to the end of this pandemic is still long, and there are no shortcuts. So where do we go from here? At what point can we say this is all over?
While it's impossible to set an end date for a pandemic, we can explain the steps necessary to reach that goal.
The World Health Organization won't say the pandemic is over until it's really over, and so don't expect that for years from now.
It's a fact that's disheartening to hear, but it doesn't mean we'll have to remain locked down for the duration.
By the fourth quarter, things might be looking really good, particularly if more and more of the population is vaccinated and we behave ourselves.
That includes behaving ourselves even after we've received the vaccine.
We still don't really know how well it's going to protect people. You can still get an infection, but still you can possibly be infectious.
So what does good post-vaccination behavior look like?
The mask wearing, the social distancing, the hand washing.
And if we follow those key guidelines to the letter?
I'm hopeful by the summer that we'll begin to start seeing a shift in number of cases and deaths. I'm hopeful.
I'm hopeful that schools could open to full capacity by August. Family gatherings, those things, you might be okay.
While this would help recreate some sense of normalcy, it's likely some things have been forever changed.
A lot more attention on personal hygiene, awareness of transmission of viruses, probably change our platforms for communication more. Think about what's critical about air travel versus doing what we're doing today. So there'll be changes.
But to get even to that point, it'll take more than just good behavior to truly wake up from this nightmare.
We need to get to where the entire population is vaccinated at a high level, like more than 90%.
Which means continuing to reduce hesitancy when it comes to getting the shot.
It's very important for people to understand that it's a safe vaccine. And we're encouraging everyone to get it.
If you're offered the opportunity to get the vaccine, don't turn it down.
That when we vaccinate, we're not just protecting ourselves, that we're also protecting our loved ones.
And once that's done,
there's not going to be like in 6 months, okay, let's all run out in the streets and cheer. It's not going to be like that. It's going to be more of a whimper than a bang.
But at least we'll be able to say, it's over.
Aside from personal safety, getting vaccinated also helps to protect those we love and care for, those we work closely with, or even those we pass in a grocery store who have loved ones of their own.
So before we go, we wanted to leave you with the stories of those who've already received the vaccine and why it means so much to them.
The this is one thing that we can do in addition to wearing our masks and maintaining social distance. We can do this together, and this is a blessing that we have access to a vaccine.
I'm protecting my wife, my family, my mother-in-law, all the folks I care for.
My husband, my son, daughter-in-law, and grandchildren.
Mi familia, a todos los nietos.
I lost a cousin, and people think it's not real, but it's absolutely real.
I'm protecting, my husband and everybody that I come into contact with.
Protección de todo el país.
My family, most importantly my family, and those around me that, they're outdoors. You just want to protect yourself and protect others.
My sister and definitely my nephew's newborn.
I want to protect my friends and the family that I do see.
I'm protecting my family, and I'm ready to get back to being able to see my parents. They're elderly, they're in their 90s, and I miss being able to spend time with them and seeing them.
I'm 68, so I want to hang around, see the grandkids and everyone else, for a little longer.
I want to spend time with family and friends.
I think you have to think of all the other people that you're trying to protect. It's not just yourself. And there are so many people dying. People don't think it is until it touches them.
It's hard. I'm getting vaccinated for the better good.
I just think it's the right thing to do. It's really never about yourself. It's about others.
Get the vaccine. This has been one traumatic experience for so many people. Get the vaccine, wear your mask, stay safe.
It's all an individual decision, but for me, it was the right decision. Have faith and try to stay safe. Really, don't take it for granted. Don't take it for granted.